Well, molecular tests for COVID-19 are the ones we are used to hearing about. The tests involve a nasal swab and should tell you if you have the virus or not. Antibody tests for COVID-19 are becoming more popular as health officials really try to work to understand how widespread this virus really is. Morning Dose's Courtney Carpenter spoke with one local doctor about who should get tested and what the results really mean.
I was kind of hoping I had it. About 2 months ago, I had a dry cough, a little pressure on my chest.
Garrett recently took an antibody test for COVID-19. He tested negative. He got the test done for peace of mind as he's still working in public and trying to be cautious for his family. Dr. Foyer, the medical director at Lifesavers Emergency Room, explains how this type of test can be helpful.
A lot of healthcare workers are getting it. People who work out in the public, a lot of people are still out working because they're considered essential workers. So they're dealing with the public every day, and they want to know if they have any immunity or any sort of protection against this.
This antibody test will show if your body has been exposed to COVID-19. So here's what a positive result means.
It means that your body does have some immunity, your body does have some fighting proteins against it. It doesn't mean that you can't get reinfected, it doesn't mean that you can't get sick, but your body has the fighting power against it.
So if you have antibodies, can you get right back to work? Not necessarily.
Those patients need to have additional testing if they're positive to know if they're still shedding virus, if they're still infectious, can they go back to work now because they are no longer shedding virus. So it does require some counseling on the results for people because everybody's situation is different.
At Dr. Foyer's clinic, the tests are done in a drive-through setting. Patients will get their finger pricked and find out the results in about 10 minutes.
The tests that we are offering have 97% accuracy and they have FDA emergency use authorization.
As we continue to learn more about this virus, Dr. Foyer says she does not think this is the time to cut back on precautions.
I think we just need to appreciate that, yes, it's low, we're doing a great job, but if we get lax and we start opening up things too fast, then the healthcare system is going to be oversaturated. I think our lives are way more valuable than the financial impact that this is going to have on us.
In Houston, Courtney Carpenter, Morning Dose.
Great information. Thank you so much, Courtney. Well, Dr. Foyer also says that the antibody tests are covered by most insurance companies. They are $150 at her clinic if you do not have insurance.